Hello, I'm Rico Cavella. Welcome to this episode of Fearless Aging. And the title of today's episode is Cannabis, all about cannabis, commonly known as marijuana, all about its uses and benefits, and also maybe some restrictions about it. So if this is of interest to you, you're going to learn all you need to know. We have an expert guest about it. So this is a fairly long interview, about 20 some minutes. So we just have time today. I'm going to play a short message from one of our sponsors, and then we'll get into the interview, and that's going to take up the whole show. So thanks for being here, and I hope you enjoy today's show.
Stop forcing down those massive pills that end up in your toilet, not in your bloodstream. Hello, I'm Rico Cavella. For the very first time in my 43 years as a personal trainer and wellness coach, I am endorsing and recommending a unique line of nutritional supplements. Superior Source produces an exclusive line of microlingual tablets that dissolve instantly under your tongue. I have a hard time swallowing large tablets and capsules, but these tiny tablets are the easiest to take I have ever found. These products are clinically tested for purity, potency, and have the highest rate of absorption. Microlingual tablets are ideal for those with digestive challenges and for infants and children, as there are no pills to swallow. They offer a full line of key nutritional supplements, including many for children. So why give these supplements a try? They're easy to take, highly absorbable, and inexpensive. Join thousands who have ditched their pills. One tablet under your tongue will make you a believer.
This is Rico Cavella, and this is your Fearless Aging podcast. And the title of today's episode is How to Safely and Effectively Use Cannabinoids Recreationally and Medicinally. Our guest today is an internal medicine doctor in New York City with more than 25 years of experience in hospital and private practice settings. She is registered with the New York State Medical Marijuana Program and is a national best-selling author, speaker, and expert consultant in CBD and cannabis. She is also a leading voice in telemedicine for bridging the gap in healthcare availability and affordability for acute care and long-term wellness. So I'm really excited today because, there's a lot of information and misinformation and a lot of hype on people just selling these products and not really knowing what's going on. So today we're going to have a true expert to really tell us really what's going on and what the studies show. So I'm going to welcome to our show Dr. Mary Clifton.
Well, thank you. That's a great welcome.
Well, thank you for being here. I really appreciate that. So I really am excited because as I think probably all of our listeners know too, the CBD oil and marijuana, it's become legal in so many places these days, and it's a big. So many people are selling products, but mostly they're just hyping their products, right? So it's hard to really know what really is the right information about this. So we're going to get that from you. So I'm really excited about that. So, but first of all,
products that are unreliable. There was the JAMA study published just a few years ago that looked at upwards of 80 different bottles of CBD and found that only 25% of them were properly labeled so that the dosing on the label was consistent with the dosing in the jar. So there are a lot of products that aren't as good as other products. It's important to know which to choose.
I've heard about that, right. But before we get going here, I'd like to know a little bit about you, other than what we talked about. We know you're a medical doctor with lots of experience, but tell us something about yourself that personally that you really say something, one of your, what you really love to do, or something that may be different nobody knows about you, or just tell us a little something about yourself.
Oh, one of the things I really like to do to maintain my health is drink a lot of high antioxidant tea. My mom and dad drank a lot of tea when I was growing up, but just at night. And I got in the same habit of drinking tea at night before bed to hydrate and warm my core. And then I thought, why am I not doing this all day long to support great health? Okay. So I started to drink green tea, but then hibiscus tea has 15 times the antioxidants of green tea. And it tastes so yummy and fresh, like grown-up Kool-Aid. So I drink a pot of hibiscus tea almost every single day.
That's funny you mentioned that because I recently just got some. I don't know how it's spelled. Is it? I wonder if it's the same one. It's PIQUE PT, and that's what they say it is. It comes in little packages already. The powder, and they say it's antioxidant, and it's also good for probiotics. They say in your gut.
Good. I think it's a great idea to have a probiotic every day too.
Yeah. Okay, but that's still something about health. So tell us something else fun about yourself.
Telling something about me.
Yeah. We want to know about you.
And myself as an individual. Well, I love to travel.
Okay.
So I go all over the country frequently. I visit my mom back in Michigan. I go visit my older daughter in Nashville, and I spend a lot of time moving from place to place and having a lot of fun doing that.
Okay, so what's one thing that you would say is the most fun thing for you to do?
Hang out with my family.
Okay. All right, that's cool. Okay. All right. You don't have anything real secret or real exciting to tell us, huh?
No, I guess I don't.
Okay. Okay.
I've recently developed an interest in hats, and I bought a gorgeous rain hat. Is that?
Oh, too bad you don't have it. You could show us. Okay. Hats are cool. You know, I really like hats on women, but I don't like to wear hats, but I like them on women. They look really cool.
Yeah, I love a beautiful hat.
Yeah, hats are really cool. Okay, so sorry, got to put you on the spot there, but just have some fun. Okay, so tell us a little bit about your journey. I mean, how you actually, became a medical doctor, and how you got passionate about cannabis and CBD oil and all that stuff.
Oh, well, I've been a scientist all my life. I always knew that I would be a scientist, but I guess a clinician is pretty close to being a science. It's the, practice of science on human beings. And so I've had a lot of fun being a doctor for years, and always very interested in innovative, disruptive ideas that allow patients to take back their health. I've oftentimes felt in my office practice that I was just giving people crutches and never fixing their broken legs, just handing them one medication after another, but I was never taking anybody off medication. So I kept trying to look for ways where patients could be empowered to manage their health without pharmaceuticals. And for a long time worked in diet. I worked in vegan diet for a long time, trying to help people eat more plants, which is a great job. It's just hard to do, and it's a hard community to work in, the vegan community. And so I switched gears a bit as I started to get more and more valuable experiences with cannabis. It was when my brother died, about just 4 or 5 months before a good girlfriend died, and their deaths, the experiences of their deaths, were so vastly different that I thought it must just be a one-up or something. Cannabinoids can't be that powerful. And then when I started to read, I realized there was a lot I didn't know. And then I realized there were a lot of other clinicians and human beings that didn't know what they needed to know. So I got to work creating these videos so people have the data they need.
Okay. Well, tell us, okay, so you mentioned they died. Do you mean, how do you mean they didn't die from... What did they die from?
No, they were dying. My brother died of colon cancer, and my girlfriend died, unfortunately, of ovarian cancer. And these were deaths where I was very, very bedside involved with the dying process. In most of the deaths I take care of, I work with a hospice nurse. She manages the drugs and talks to the family. But in this case, I was the family at the bedside administering the drugs, and really noticed a powerful difference with cannabinoids compared to without. So that started my whole path. But there are so many other diseases that respond well to cannabinoids, serious diseases like multiple sclerosis or seizure disorder, but also very common diseases that plague a lot of people, like anxiety and insomnia, where cannabinoids have a place in helping people to heal.
Well, tell us the difference between, there's lots of information about how CBD oil, and I want you to expand on this a little bit, how it really does help reduce pain and inflammation, a lot of those sort of things. But tell us the difference between, so we really get clear on the difference between CBD oil and actually marijuana, which has THC in it.
Yeah, CBD is just one of the cannabinoids in a typical medical marijuana plant or cannabis sativa plant. There are 100 cannabinoids that have been identified. THC is one you always hear about because that's the one that gets you high. That's the
Mhm.
one with the psychoactive effect. And then the CBD is the one that functions like the workhorse in the plant. You know, it helps with muscle spasm and it helps with difficulty sleeping and anxiety symptoms. It's really a very powerful cannabinoid. There are other cannabinoids in the plant, CBN, CBG, CBC, that also have different levels of effects on the immune system and also on the anti-cancer effects that are being learned as we distill further and do further studies on individual products.
Yeah, can you tell us about some of the studies that?
Oh, sure. I mean,
Yeah.
I love to think about CBD and pain. My favorite study is one of a group of fibromyalgia patients where they treated them with inhaled cannabinoids, and they were able to take every single one of them either off or dramatically decrease the medications they were using for pain. It's very frequently when you're adding cannabinoids to chronic pain patients, you can cut their use of opioids in half and sometimes remove the opioids completely. So
That's,
that's very exciting for pain.
I've read that we actually have a cannabinoid system in our body.
Oh, yes, you already have the endocannabinoid system, and your body
Endocannabinoid.
already makes the anandamide and 2-AG, the naturally occurring cannabinoids, just from the lipids in your system, just from fats that you already have in your system.
Okay.
And you can make that level of cannabinoids go up or down, you know, depending on the types of foods that you eat and the type of relationships you have. The cannabinoids are already in your system, and they help to just modulate your response to inflammation or infection or trauma
Okay.
so that you maintain homeostasis.
Very good. Okay, so if someone who wants to use CBD oil, so how can they know if the product is really has in what it has in it, and which products are best? How would they go about that?
Well, it's important to buy from somebody that you trust. But if you don't have anybody that you can trust for good recommendations, you can always also check the bottle for third-party testing. A number of companies do third-party testing to
Right.
see to assure that their products are good, and they should be doing third-party testing on every batch. There's a few products that actually do third-party testing that you can track very well, and that just assures you that you're getting consistent high quality, because some products came on the market really high quality even as recently as a few years ago. This industry is growing fast and things are changing hands, and then suddenly the product isn't what it used to be.
Yeah. Yeah, I have got involved with one company, and they do have the third party testing, and they also offer a guarantee. You know, if you don't get the responses, and so what would you say that for people that what again? Can you emphasize a little bit about what different issues and ailments that really respond well, and what you think it'd be really worthwhile for them to try it?
Yeah, I mean, I think in a lot of cases, common things being common, you know, insomnia and anxiety are hugely able to be treated with these products. There's one study out of a Canadian jail that is actually a jail for criminally insane people.
Oh.
So this was a fascinating study because the patients could be watched so closely because they were in jail.
Oh yeah.
No way to, you know, just make a bad report on how many hours you slept or whether or not you had a nightmare, because, you know, they were in jail and they were easy to monitor, and they used cannabinoids on these patients and then were able to not only decrease their other medications, which really helped contribute to smoothing out their pharmacy needs in general. But the patients went from sleeping an average of 5 hours a night to 7 hours a night.
Wow.
And many of these patients are having nightmares every single night. I mean, they're very ill with mental instability. And they were able to reduce the nightmare frequency from 5 nights a week to just 2 nights a week. So the sleep is a very nice, restful sleep, and people who even have chronic trouble falling asleep and staying asleep end up getting a lot of success with using some CBD before they go to bed.
That's so important. Sleep is so important.
So important.
Okay, so let's talk about actual marijuana with THC then, because our title is also how to use it recreationally. So let's talk about recreationally a bit.
Yeah, a lot of people are worried if they're going to use it for the first time and they want to use it safely, that they're going to avoid an acute psychosis like a reefer madness, where they go crazy and
Yeah.
fly off the top of a building. The main thing to avoid is just too much if you're trying to use things recreationally. And so, especially if you're starting out and you don't know how much you need, it's really a good idea to avoid the edibles. Because once you ingest the edible, it's in. You can't really get it out, and you can't
Yeah.
can't titrate it because it's 60 to 90 minutes before the onset of action.
Right.
So waiting around and then suddenly you've had too much. So especially if you're starting and you're trying to think about how you want to position this recreationally, getting a product that you can smoke, or that you can use a tincture where the tincture onset of action is 6 to 8 minutes. Then you can adjust your dose a little bit more real time and not get yourself in a situation where you're uncomfortable.
Right. Well, I think we should be clear that a CBD oil has such a small amount of THC that you don't get high from the CBD oils. So CBD oils are just used medicinally. But if you want to smoke marijuana or take, like, say, edibles, so what is the other than whatever high you get or whatever enjoyment you get out there, what are some of the other benefits of, say, of smoking marijuana? Can that help with pain and sleeping and all as well?
There's a lot of people who think that their pain or their anxiety or their PTSD or sleep, a lot of things respond very well to the addition of some THC along with the CBD.
Okay.
And especially if you're trying to manage nausea and vomiting in chronic disease or in cancer chemotherapy, the THC is a very important component to be used in those cases. It appears to be key, but a lot of people believe in this entourage effect, where it's not just your CBD that's helping to control symptoms. It's all of the cannabinoids in a complete whole plant, along with the other phytonutrients and the terpenes that really help to bring relief of symptoms maximally. So you're right, CBD, in order to be marketed as CBD, needs to be less than 0.3% containing THC. It's a wisp, and it's not going to get you high. But as you go up on the THC, people sometimes report better control of their symptoms.
Right. So do you think eventually even marijuana is going to be, it's probably going to be legal in all states eventually?
Oh, I expect that it will be. I don't see any reason why it shouldn't be. I think we got into this prohibition, and in retrospect, it may not have been the smartest thing to do. Yeah,
no question. Just like alcohol. Well, of course, alcohol can be a really big problem as well, but you can't just say nobody can drink any or smoke any. Tell us, are there any mainstream like hospitals or medical facilities that are using CBD oil now?
Mainstream, probably not exactly mainstream, but I think that there are a lot of circumstances where even 5 years ago, patients were telling me that they weren't allowed to bring their medical cannabis into the hospital, or they weren't allowed to use it while they were in the hospital. But now, folks who are using medical cannabis chronically are often able to continue that treatment in the hospital as long as they bring their own and it's cleared hospital pharmacy.
Well, that's good. So would you consider yourself like an integrative medicine doctor?
No, I'm an internal medicine doctor through and through, board certified for 25 years. But I love to think about things that help patients take back their health, and I love innovation. And I think within cannabis and CBD, there's so much value. The thing that I love is that when patients have anxiety and they're in my office, I give them a dose of anxiety medicine. If that doesn't work, we increase the dose. We may add a second medicine. But patients don't feel the same way every single time.
Right.
You know, you'd be very anxious on Monday, but very calm on Thursday. And they still have to take the medicine, or they're going to face some withdrawal syndromes, you know. So I can't really give them a medicine that responds to their needs. But if you're using cannabinoids, you know, if you're anxious, you take some. If you're not, you don't, or you take a lot less. So it really puts the control back in the patient's hands. And I think overall results in less medication administered over time.
So do you recommend a CBD oil for some of your patients?
Oh, absolutely.
Oh, great. Really
I
good.
do. I do a lot of consulting work on people who are thinking about how to position CBD or cannabis, you know, as individuals, and then also for, you know, companies and dispensaries.
Okay, well, I have to admit, you know, I've been around for a few years, and you know, I was in LA in the '60s, you know, and when a lot of marijuana came out, and we smoked a lot of marijuana, and I've smoked marijuana, you know, occasionally here and there, and so what do you think about? I mean, there's some people that say that it's not so good for you as far as it can, just like alcohol, destroy brain cells and all that. What do you think about that?
We really don't have any data to support that. There is data that if you're using cannabinoids routinely, you can see measurable decreases in concentration and short-term memory. Right. But continuation of the products for 3 months reverses any of that. Okay. There were some studies initially out of Britain that suggested that if you're using the products in your young adulthood, that you could see an IQ drop of 6 points. But then subsequent studies in New Zealand suggested that that initial evaluation wasn't true. And then there's been more recent research out of the United States that actually had 6 or 8 pairs of discordant identical twins, where one twin smoked and the other twin didn't. Those are really powerful studies. Yeah. Like that's what happens. There's no difference between twins, and the larger U.S. study showed no impact on intelligence.
Oh, that's good. So I go, whoa, maybe I. Maybe
no,
I
you didn't become it didn't hold you back, no matter even what your mother was said.
Okay, yeah, your mother, yeah. Oh, okay, so you mentioned that you have some videos some training videos or some videos about cannabis and all that.
I have a couple hundred videos that are available on my site for free, so that if you have questions about how to use the products,
great.
You can consult the videos, and then hopefully you'll feel more confident.
So what is that address of your website?
Oh, the site is cbdandcannabisinfo.com. The "and" is spelled out.
Spelled out? Oh, I want to go there too. So it's CBD and say it again. CBD
and cannabisinfo.com.
Okay, and I'll actually put that, you know, underneath the when we put it up there. I'll put that address there as well. Okay. So, anything else that you want to say, or if somebody wants to get a hold of you?
I was just going to say, if somebody goes on the site and you are looking for a particular topic and you don't find it, I'm sorry about that. But if you have a particular question, just message me. All of the messages on the site come straight to me. And if I don't have it in my roster to shoot that video, I'll add it, and you'll have the video you need to questions answered.
Really nice. Really good.
Consults anytime.
Great. Well, okay, so I really want to appreciate you being on this show and giving us some really great information. And so do you have anything, what would be the last thing you'd like to say to people to maybe assure them that if they think that there's something that could work for them, it could be a good idea to do that?
Yeah. I mean, I think this is a very safe product. The safety has been very well established. It's legal in all 50 states. You just have to be careful about transporting products like this over state lines yourself. Leave that to a bigger company. But it's safe and legal and worth a try for some of the chronic medical conditions where it appears to have benefit, things like insomnia, pain, or anxiety.
Very good. Well, Dr. Mary, thank you so much for being here. It was a lot of fun and really great information, and I really recommend people to go to your website, and we'll post that address as well. Great. So, yeah, great. So thank you so much.
You're welcome.
It was really my pleasure to have you. So that's it for today, and this ends this episode. And one time I always remind you that I still have the offer. You can join my Be Bold, Never Be Old online wellness club for just $1 for the first month. So go to BeBoldNeverBeOld.com. Thanks for being here, and thank you again, Dr. Mary. Dr. Mary Clifton. Really nice. Appreciate that. All right. If you want to hang on for a second, we can talk a minute.
Sure.
All right. That's our show for today. We just got like about 20 seconds left. So thank you very much for being here. And if you enjoyed today's episode, tell your friends about the Fearless Aging podcast. We're now also on Sundays at 4:30 Pacific time. Go out and make it a better world for everybody.